Sup guys, Vicky here, and this is my case management project. To give some background about my patient, he is currently diagnosed with late onset Alzheimer's and Parkinson's disease. He is not adhering to his medication regimen, and this started when his previous psychiatrist left their company and they fell out of contact. He lives with his wife, who is his primary caregiver, and his 11-year-old grandson. He is in the hospital because he threatened to kill his wife and has been exhibiting behaviors consistent with physical and verbal abuse, including punching her in the face. However, chronic abuse has been ruled out, so it is believed that these instances are pathological. His wife fears for her life and feels unable to continue taking care of him. During his hospital stay, he repeatedly becomes confused and tries to leave the bed despite his muscle weakness and his high fall risk. He becomes aggressive and combative and requires a security guard posted by his door. Currently, both neurology and psychiatry have been consulted, and they think his Parkinson's is misdiagnosed. Let's take a quick overview about this patient. Medical equipment he uses include a wheelchair for mobility, a slide board to transfer himself back and forth onto said wheelchair, and a 3-in-1 bedside commode for elimination. Current barriers to discharge include his acuity and his lack of stability. He has repeated visual hallucinations of insects and people on the front porch. The plan for his discharge as of now is placement at an inpatient psychiatric facility. In order to promote his health, he should perform lower limb exercises, which include ankle pumps and long arc quads. Physical therapy can be contacted to help him with an exercise regimen to preserve his muscle function. For his long-term needs, like I said earlier, he needs to be placed at an inpatient psychiatric facility, and we'll talk about home safety concerns later on. Now let's look at some goals for this patient. We want adherence to medication regimen, and this will be done by placing him in contact with a new psychiatrist. We want caregiver well-being with plans for a positive future, including self-satisfaction, a sense of control, and a sense of security. Client will remain content and free of harm, and client will participate in ADLs at the maximum of functional ability. Now let's look at some financial considerations for this patient. He worked as a machinist at a warehouse for 45 years, but is now retired. He's currently enrolled in Medicare Plan G, which is a plan with a high deductible. It pays 80% of healthcare costs after the patient has finished paying the deductible first. The Mutual of Omaha supplements his Medicare by paying the remaining 20%. He is shown to have no financial issues with obtaining medicine, although financial strain will occur with inpatient placement at the psychiatric facility that I mentioned earlier, so his wife started a GoFundMe for his treatment. Now let's look at some cultural considerations. The patient believes in or associates with white supremacist ideals, and this is evidenced by his white supremacist tattoos on his body, and he's also called a security guard racist slurs for being black. He has no barriers to learning evident, because English is his first language, and he is non-religious. Some environmental considerations include home safety concerns. This includes wheelchair accessibility, so ramps for entryways, wide doorways, and floors clear enough for a wheelchair to turn around in. Hard floors are better for wheelchair maneuverability than carpet is, and his bathroom should be accessible. This includes having a shower with handles and a seat in it, and doorknobs can be adjusted so that they're easier to turn in a wheelchair. And due to his work, he may be exposed to pollutants and airborne particles, and this can lead to respiratory issues. Now let's look at some discharge education. This includes fall prevention, so we went over this in environmental considerations, talking about the wheelchair accessibility, and this also can include lowering the bed, having bed rails, wearing no-skid socks, and having mats on the floor. Some activity recommendations, which include the exercises that we talked about earlier, the range of motion exercises, the lower limb exercises, the partnership with physical therapy, some compensation strategies for gait impairment because he's got Parkinson's, and these can include bouncing a ball while walking and crossing his legs while walking, and this can help him with balance issues and just walking around, and access to assistive devices, which include liftware utensils to promote independence in people with hand tremors. So these spoons and these forks will help you lift food to your mouth without shaking, and this can promote independence with his ADLs. Here are some resources that may help. Financial wise, there's a Norton Healthcare Financial Assistance. This has an application that you can fill out to get financial help with paying bills. There's a Patient Advocate Foundation, which is a nonprofit to help resolve financial crises such as debt, and SNAP, which provides nutrition assistance to low-income families. Mental health wise, there's the Morton Center, which provides counseling services, and this can help him get into contact with another psychiatrist so that he can resume taking his medication. Does anyone have any questions? No? Great. Here's my sources. Alright, that's all for today. Make sure you smash that like button, leave a comment below, and subscribe for more videos if you enjoyed this one. Thanks.